So now to sort of say a little bit about UKHSA and what the case study there was and why they chose DOS 6. So UKHSA are a relatively new organisation. They were formed out of the COVID-19 pandemic. They were formed of a number of organisations, the largest one being Public Health England. And they have a remit which is essentially to protect the nation from infectious disease and environmental hazards. So they are not just health, although that's probably 80 to 90% of their work, but they're also responsible for protecting the nation from the effects of climate change, for example. The response to the COVID pandemic was a fairly intense period for the organisation, and it required a sort of change of ethos to just get things done, essentially, if I had to sum it up. And what UKHSA are trying to do at the moment is transition back into being an organisation that's less about, response to an immediate crisis or health crisis, and more one to that is protecting the health of the nation on an enduring capacity. And that means maturing their approaches for doing things and essentially coming out of a sort of emergency response way of doing things. Now, they've got quite complex relationships. They work closely with Department of Health, but they work closely with NHS hospitals across the entire of the UK. They work closely with the Home Office. They work closely with DEFRA. They work closely with local authorities. So they've got quite a complicated stakeholder landscape, and they are engaged in many different projects across a quite plethora of different health and climate outcomes, a couple of which I'll mention in a moment. So the requirement here was to go out for a set of client-side partner outcomes. So UKHSA run large procurements with sort of big multinational outsourcers who are providing a lot of their infrastructure. And one of the challenges that they had was that they did not have sufficient internal staff capacity or capability to actually run a lot of the programs. And they were looking for intelligent client support and outcomes around that. So they went out to DOS 6 for a client-side partner requirement, working across their health and climate change outcomes. Next slide, please. So the solution. UKHSA have within them a technology business partnering division, and they are responsible for delivering the majority of the digital transformation programs that UKHSA have. They are very, very values-based. So their philosophy is very much one team. And that's really important because in a lot of the projects that they're running, you could have half a dozen suppliers working together alongside UKHSA staff. You're also working with specialist science staff and laboratories. So there's a real need for cross-team working. And I know it's a bit cliched, but it's a very badges at the door environment. That's absolutely essential. So culture was very, very important for them. And what they were looking for was support across the full range of DDAT roles. So everything from sort of delivery and program management through architecture, through UCD, through DevOps support. They're working across the full sort of gamut of it. So if I can have the next slide, please. Thank you. So we had I've just completed an extremely busy, actually, and very rewarding first year of our engagement with them. They were a new client to us. And as you can see, some statistics there. In the first 12 months, we've helped them with close to 300 program outcomes across quite a number of different areas. 5 discoveries, alphas and betas all done in the first year. And also, it's quite an interesting point. Again, this is a great sort of use of DOS and the flexibility of it. There was an almost 50% increase in demand for services that we needed to put through the contract in the first year. So a very significant uplift, which again, we were able to do with the sort of budget and time flexes within the DOS framework. We have a team of anywhere between 30 and 50 people working with them at any one point in time across health protection operations, pandemic preparedness, vaccines development, antimicrobial resistance, genomics, climate change, infrastructure and networking, DevOps, even some procurement and finance outcomes, PMO, and organizational design. So you'll get from that sort of quite a spread of things. to give a flavour, I thought I'd just pick three of those to talk a bit more about what they do. So one of our large engagements is working with them on something called Surge Response Service. And that's essentially a replacement for what was test and trace during COVID-19. So what the agency is trying to do is build a pathogen agnostic test and trace system that they can essentially take off the shelf and then rapidly configure in the event of a future health pandemic. One of the challenges with COVID-19 is a lot of the systems had to be built from scratch, built very, very quickly. So they're difficult to adapt. For obvious reasons, they've been built very specifically around COVID-19. And one of the big learnings from that is it would be better to have more agnostic systems that would leave the agency better prepared. So we've worked with them on the delay and contain World Health Organization pandemic phases, which is really all about ordering and dispatching test kits, uploading results, getting results from laboratories, and also contact tracing. So using gov.uk style interfaces there and providing architecture, delivery, and UCD teams in to support the outcomes and working alongside a number of other partners as well. We also work with them on tuberculosis pre-entry screening. So one of the visa requirements for travellers to the UK from certain countries around the world is to show that they're free of tuberculosis. Tuberculosis is actually quite a difficult and expensive disease to treat. And the UK is currently dependent on overseas clinics to test people and provide the results, undertake the screening, and provide a certificate that they are free of TB. Now, quality can be quite variable in the work of overseas clinics, and there is a need to have greater assurance. One of the challenges is it is possible to take a short course of antibiotics and then have a chest X-ray that shows up clear, and actually you have an infection, TB. So what the agency is trying to do is essentially improve the assurance and scrutiny that it's able to do over that of travellers arriving at UK ports of entry. So we're working with them to replace existing systems, and again with a long-term ambition to use AI and other technologies to improve the screening of imagery that we get. We're also working with them on case management systems. So they inherited a number of case management systems from their constituent organizations, and we're modernizing that. So one case management system across all of their different regional offices, their laboratories, and also one that's capable of scaling for contact tracing in the event that there were to be another public health emergency. So I hope that gives a little bit of a sort of feeling or flavour for the work that they have been putting through the DOS 6 framework. And again, the flexibility of that has been extremely important, and also the focus on outcomes. Next slide, please. So I thought I'd just end with a quote from Mary Grice, who I work with very closely as the Deputy Director of Technology Business Partnering. Again, culture was so important here. It's so easy when you have multiple supplier environments to sort of get into situations where it's hard to get accountability. Fingers start getting pointed when things aren't being done. UKHSA have created a great environment where everyone supports each other, and there's a real drive to cross the line together. And also that there are good sort of honest conversations where things aren't working, actions get taken, and teams work together to improve situations and also build on lessons learned. They've got vibrant communities practice, and in my experience, they really are committed to getting the best outcomes. So I think these cultural things are also really important in your procurement, and make sure that you get suppliers that are aligned with your cultural values as well. That is all I'm going to say on that case study. So if there are any questions, either now or afterwards, I'm happy to take them.